Been reported this morning in the Herald Sun that the St Vincent's Hospital Emergency Department fast tracks Indigenous patients over non-Indigenous patients.
Sometimes equality means adjusting the system so that everybody gets the same chance to survive. I don't understand what all the noise is about. Apparently St Vincent's are fast tracking Indigenous patients. And people are saying, oh, that's unfair. From a medical point of view, it is completely appropriate. Stay with me for a minute and I'll explain it. Emergency medicine, we triage all the patients that come in, and it's based on your clinical risk, not on who walks in the door first. So if you're a category 1, it means it's a life-threatening problem, you need to be seen straight away. If you've got a category 5, then it means that you can safely wait for a while. But what St Vincent's have recognised and have done is that Indigenous Australians statistically come in sicker, have more complex disease, face longer delays in getting care. So because of that, they are now going to start at a category 3, which means that they get seen before the category 4s and 5s. And they're absolutely not skipping the queue. They are being assessed with the real world risk data that we have. Indigenous Australians are at higher risk of things like diabetes, kidney disease, heart failure, infection. And when those conditions deteriorate, time really matters. I've worked in Indigenous communities and I've seen firsthand Indigenous people present later because there is a distrust of the medical system, and I don't blame them for that with all the stuff that's happened before. By the time they get to the emergency department, they're usually far sicker than what their paperwork suggests. From a clinical point of view, earlier assessment in Indigenous patients leads to better outcomes. It's not political, it's triage, and it's evidence-based medicine responding to a known health gap. And it's a shame that something like this, which is supposed to be a positive thing, is being used to grab headlines and spread division. I completely agree with it.